DJ Liguori. Thank you very much. We are on podcast number
11, I think.
Is it 11?
I think this is 10
or 11.
This is either 10 or 11.
All right, so either 10 or 11. We'll look up the number.
I think it's 10. I don't think we've hit double digits yet.
Yeah, I think it might be 10.
Mark was 9.
Hopefully we'll get it right eventually. So we're here today to do a little COVID-19 discussion with Chris Biryla. Very excited about that.
Yes.
Also here with Acres of Diamonds co-founder DJ Liguori, who is good friends with Chris, both St. John Fisher grads and football alumni. So that's awesome. And we brought Chris on. First things first, Chris. COVID-approved mask or not?
Oh yeah, I would say
this is COVID.
COVID that definitely would pass hospital regulations.
This is PPE approved.
PPE, it's perfect.
Personal protective equipment approved, according to Chris Biryla.
If that is a fashion statement, I think.
Yeah, so we really enjoyed it as a family the other day. We wore it. I wore it while I was driving for a little bit, and then Aaron wore it in the back seat a little bit, and
I got some dirty looks.
Yeah, I got some dirty looks. Got some dirty
quite
looks.
a bit of looks.
Not everybody thought it was as funny as we did.
Yeah.
But well, yeah. Thank you, DJ. I thought this is a great idea. As usual, you have a ton of them. So today we're gonna get Chris's perspective on pre, during, and post-COVID life.
Yeah.
Right. From his perspective. And what is Chris? What is your background?
So before I get started, I just want to say it's an honor and a privilege to be on this podcast. I've been following you guys since day one, honestly. Like, I love the message you guys send, the positivity. You know, it's something that, times like this, you got to get around. But I graduated from St. John Fisher in 2019, and I've been a nurse now for almost a year. So they just thought, you guys, everybody sees the outside, like the views from the outside, so hopefully I can provide some inside views, what's changed in my life as a nurse, hopefully just open up some eyes and give you guys some useful information.
Great.
Yeah, because I think to what Chris just mentioned, we gave our initial opinions of the COVID-19, and in one of our videos, I think it was the confidence, fear, and learning and growth video, one of those, and we did our pre, during, and post-COVID attitudes. But like Chris said, we're an external individuals. We're not essential frontline workers.
Yeah, I mean, honestly, we don't know shit, right?
Exactly.
We have
opinions, but
right.
Yeah.
We have personal protective opinions, PPO.
Yes.
PPO.
Yes.
But none of it means anything except what we want it to mean.
So his opinion will be much more accurate than ours probably will.
Hopefully.
Yeah.
He did prep us by saying, look, he doesn't have a ton of data at his fingertips. So we're not here in that way, but he definitely has a much stronger position to comment from than we do.
Much more professional comment.
Yeah.
We'll say that.
Yeah, cool.
Loose term.
Yeah.
Loose term professional.
It's all right. More of a professional than we would be. We
for
could
sure.
say that.
For sure.
That. Yeah.
Yeah, I don't think he'd ever be caught wearing the Lone Ranger mask. Let's put it that way.
No.
So from the standpoint of your role today, you're an RN. Where are you?
At Strong Memorial Hospital.
And you have a specialty that you focus on.
Yeah, so I am currently a nurse in the cardiac ICU.
Wow. All right. What is so ICU means that all the patients you have are obviously then in critical condition.
Yeah, so we get patients right out of the OR pretty much, or prior to going to the OR when they're a little more unstable, and we kind of we have the equipment necessary to just continuously monitor people. It's very invasive. There's a lot of risks that could happen. They just kind of prep us to make sure before something happens we have the knowledge to see it, to hopefully prevent anything serious from coming about.
What Chris said something to us about. Do you remember, DJ, when he talked about all the things going in and out of the body?
Oh, I know. Yeah.
The graphic. So give people a graphic of what an ICU patient might look like relative to the goes intas and goes outas.
Yeah, that goes in, that goes out. All right, so I'll paint the picture. You know, when we get a patient right out of the OR, so first thing that they come up with most of the time is they'll be intubated. So they'll have a tube that goes literally right down their throat, pretty much. That's providing the oxygen for them. You know, we could set it at a set rate and provide. You know, we could either be their whole lungs or we could start to wean them, and eventually, you know, the goal is to get them extubated within hours once they come up. Along with that, we have, you know, radial lines that give us direct blood pressures. You know, it goes right through the arm and all that, something that you won't see on a normal floor. You'll have chest tubes, you'll have cannulas. Sometimes we're doing bypasses, so we have circuits that can literally bypass your lungs or your heart. And you know, obviously we're going to keep you heavily sedated because you get all these tubes in you. Any swift movement out of a patient, you can pull it all out and everything, you're back to square one, sometimes even worse. So you know, we're pretty diligent on just maintaining, you know, making sure you're doing well, keeping you asleep, hopefully. So, you know, the stuff doesn't feel good, having all those tubes in you, I could imagine.
So how many different connections or tubes or IV lines or PICC lines do you think a typical ICU person would average?
Well, I'm sure you guys have seen pictures on like Twitter and stuff with all this COVID going on. You know, they could have anywhere from like 5 to 6 to, I've had patients who are on 12 just IV lines. You know, you'll have dialysis lines, you'll have like reperfusion catheters. You know, you'll have 5 different IVs, all with different medications going through them because they're not compatible with each other. You have the ECMO circuit, which is the bypass, pretty much.
When you say the ECMO circuit is a bypass, what's a bypass? So I get that it's going in one leg and it's coming out the other leg, right?
Yep.
But what's it doing? Is it blood? Is it urine? Is it
oxygen?
What is it?
It's all blood. So you got to look at it as like we have to enhance oxygen perfuse. You know, we got to perfuse all the organs and everything. And with COVID going on, people are VV ECMO, which is like both venous. It goes through the venous system, and what that actually does is it can bypass the lungs, so we can actually be an artificial, in a sense, lung, like we're their lungs.
So you're artificially oxygenating blood. You're performing the function that the lungs perform, which is fundamentally to oxygenate blood.
Yep.
Outside of the body.
And outside of the body.
It's outside of the body.
So it's almost a dialysis type of process.
Exactly.
Okay.
In that sense, yeah. And with COVID and everything, they've actually found that if you prone the patients while they're on this type of circuit, it's said to have better beneficial effects, and that meaning you're on your stomach on this circuit, which is something that, you know, it's been done before, but it's very strange when you think about it, because you also have the ventilator, which is coming out your mouth. You have tubes everywhere, so it's kind of like it takes multiple nurses to take a bed sheet, slowly flip this patient over onto their stomach to better oxygenate them, along with not pulling out anything.
Wow. Holy! I just visualized that, and it's like, I mean, just thinking of the tubes, like, you know, the way you're stepping on somebody not working completely incoherent.
I'm a klutz too, so you gotta put that into perspective.
Do they let you flip the patients over?
I'm very cautious with it, so you know. Yeah. I know my range. I know what I'm capable of. So
just do you. Just do you.
I know my role. Role.
Stay in your lane.
I'll just hold everything over here.
Yeah.
You know?
I'll hold all the tools.
Well, so pre-COVID, when the patients are in this condition, right? Mm-hmm. Are visitors allowed, and if so, how often? So
pre-COVID, yeah. So we, you know, we like to try to keep limitations on it, just because when you're in the hospital, you know, you're not the healthiest you've ever been. You're immunocompromised. So we try to limit like 2 to 3 visitors coming in. You know, obviously things change, and sometimes the rules aren't super strict about it. But now, about a month and a half ago, with all of the limitations that the government's put on, we actually allow 0 visitors now. And that's something that's kind of like opened my eyes to, because a lot of these patients, you know, they're scared. Some have never been in a hospital before, and this is kind of so new to them. And they don't have anybody to be there, like in their ear, just trying to calm them down. They have us.
So that's a really good point. So a couple things here. How old are you?
I'm 23.
So you're 23, brand new to the role.
Yeah, I'm a baby pretty much.
So your only exposure to people in ICU pre-COVID was a few months.
Yep.
And it was all with visitors.
Yep, visitors were allowed, you know, we didn't have to wear the masks, you know, we're wearing these masks now for 12-hour shifts. If you have someone that's been, we're testing for COVID, you gotta wear the gown, you gotta wear specialized masks, you gotta wear the gloves, everything. And I'll tell you what, after 10 minutes of being in one of these rooms and all that PPE, it's looking like an Under Armour on me. Friggin' sweating.
Just drenched.
Yeah,
you're in the best shape of your life, though.
Exactly. Oh yeah, it's a good workout.
It's
a good workout.
Well, that's really interesting. So you, unfortunately, then you're seeing very real time the contrast between how patients respond with their loved ones being allowed visiting rights, right? And we talk about this all the time, DJ, the emotional impact of COVID isolation, right?
Oh yeah.
You and I talk about this at a personal level. And now you're seeing, so give us kind of your summary of what you're witnessing relative to people not having loved ones come in and visit them.
So once this visitor restriction thing came about, you know, they're scared. They're in a single room by themselves for hours upon hours every day. Sometimes, you know, they're not even with it enough to watch TV, or, you know, we got to put restraints on them because they get so confused they're not able to, you know, they're trying to pull out their tubes and all of that. Yeah. So it's such an amazing feeling, like, to see, like, the healthcare workers kind of working together in the sense of, like, trying to provide that relief to these patients. I've seen it myself, social work. You know, we have a girl, Melissa, on our floor who individually sets up FaceTime calls every day with all of our patients for their family members, just to see face to face and kind of, yeah, it's an amazing thing.
It's so important for those patients.
Oh my God, it is. And you don't even think about it. Like, a lot of these patients, you know, they're intubated and all that. You don't think that this matters, but it really does. Like, yeah. They'll wake up, they'll tell you, you know, they're able to hear everything, you know, just that little glimpse of hope in the background, you know, it means a lot.
I mean, think about family members who might have been sick before. I mean, what you know, hopefully not COVID or anything like that, but going into the hospital and seeing them about how much they light up. Like, those little moments of just seeing somebody that you love can probably totally change your psyche too. Yeah. And make you want to totally propel forward. So those FaceTime moments and those calls, those are probably doing exponential in wonders of, you know, keeping these patients in a mental state of, I'm okay, I'm going to make it through this.
Yeah, it prevents delirium too, you know, just having that familiar voice there. It really does help.
Yeah, familiar sound.
So how is, are you intentional, you as a man, as just a human being interested in improving the lives of other human beings? How has that changed your intentionality walking into a patient's room, seeing what Melissa does and the impact, seeing the lack of resources, personal resources available to these patients emotionally? How has your role changed, and how have you dealt with that intentionally and deliberately now when you walk into a room?
So I would say the biggest thing that I've taken out of all of this so far is just having that mentality of, you know, I'm here to improve your life in a way. You know, every little step in the right direction is huge. You know, you gotta kind of enforce that into their mind. I know you guys have a quote, like a motto. You guys, what is it? What's the exact quote?
Measurable progress over reasonable time.
Exactly. You know, you gotta tell them, it's a marathon. It's not a sprint. You know, all these little one step forward is huge. And a lot of the time, you know, they're looking at the bigger picture, and you just got to reinforce it. You got to be that smile, even if you're wearing a mask and they can't see it. You got to provide that hope. Just, you know, be that sunshine in their lives type of thing. You know, these rooms, they're gloomy. You know, nobody wants to be in a hospital. Nobody wants to see me walk in. They want to see their family member, someone that they loved. But I just, you know, what I've taken away from it is just providing them with a good time in a sense. You know, I just try to be that smiling face. Just if they need anything at all, you know, I'm here for you.
It's a very neutral way of thinking, if you think about that. If, you know, it's like Chris said, it's not a sprint, this is a marathon. So today is a very small opportunity to get just a little bit better. Then tomorrow is another one. And, you know, you might wake up and say, oh, today's going to be a bad day, or today's going to be a good day. Today's just another day. Especially in that type of environment, like you said, you know, these rooms, nobody wants to be in a hospital. And they might, as beautiful as Chris is, they might not want to see Chris walking in. They'd much rather see a loved one.
Yeah.
And so that, the neutral thinking is probably a huge way for these patients to actually probably make measurable progress over a reasonable time.
Yeah, I hadn't thought about that until you brought that up. Yeah, so I'm not happy. So I'm not happy to be lying in this bed, regardless of, you know, Melissa being a ray of sunshine, regardless of Chris being a ray of sunshine. I get that. At the same time, it's a hand I'm dealt. What am I going to focus on to get better today?
So I can see those people I love.
Right. So some level of hope, some level of vision for the future.
Yeah.
You know, this is so interesting. My mother was, I was telling Chris off camera that my mother was a nurse, emergency room nurse for 40 years, and she would call herself worst nurse worse, and her patients loved her, and my mother was always very self-deprecating about her technical nursing skills, but as she learned over the years, her technical nursing skills aren't what drew patients to her. It was her bedside manner that they remembered. She told me a story the other day of a 4-year-old boy who's now 10 or 12 or 14 or something like that still remembers his visit to the emergency room with her, not because of anything she did with an IV or a shot, administering a shot or anything like that. It's because of how she made that patient feel. That's what was remembered, and that's where Melissa, right? I mean, please, on our behalf, on the Acres of Diamonds behalf, please tell Melissa, thank you.
Oh yeah, well,
yes.
Thank you for bringing hope to these people, right? And thank you, Chris, to you for bringing hope to these people in a very, very difficult situation. I wanted to say thank you to my cousin Becky Gibbs, who's out in Colorado, and she's a nurse as well, and she, oh my God, she has such a sense of humor and such a ray of sunshine for people, and I know in these situations you guys get emotionally drained because, you know, you're giving so much. I would encourage you to make sure you have somebody in your life that's giving something to you too, because this has got to be hard on you.
yeah. I mean, I signed up for this type of job. You know, I hate hearing, oh, you're a hero, you're a hero. It's like this is the profession that I chose. This is what I love to do. So, you know, I do appreciate it. Don't get me wrong.
Yeah.
I'm not going to be like stop,
Yeah.
but you know, it's what I chose to do. This is the career path that I enjoy doing. You know, I couldn't imagine, you know, working from home. Like, I'd go crazy, or being in an office chair. Like, it's just not me. So I do appreciate it. You know, we do have a ton of support that our hospital does provide as well. They set up Zoom meetings practically every day to update us, and, you know, just provide us with reassurance that, you know, if we need anything from them, that they're there for us as well. They've done actually a really good job at that. Just, you know, if you need somebody to talk to, or if, you know, these issues are kind of weighing you down, please, like, open up. We're here. Yeah, it's awesome to see.
Now, has there been, I'm curious, has there been a patient come in that has the virus, you know, test positive for it, you successfully cure them, and then when they leave, are they just super gracious of all of your care and in your bedside manner? Like, what's that process of that whole timeline?
Yeah, so we definitely have seen that. Unfortunately, they can't come back in to see us because you know, because of the restrictions and everything. But we have gotten baskets with like food and just appreciation posts. Like, and that's honestly the world. It's the world to us. I mean, yeah, we love food. We're nurses, but just hearing back from them is such a huge. It's a warm feeling. You're just like you're so grateful that you had an impact on them enough for them to think about you outside of the hospital. That makes a world of difference. It can make someone's day, someone's week even.
Yeah.
Just hearing back, just hearing that they're doing well, and they're thinking about you, sending their prayers.
Like everything
It's
you're
awesome.
doing, everything you're doing and did.
Makes it all worth it.
100% worth it.
Yeah.
Yeah, that's cool.
Yeah, that's fantastic. One thing that I think we want to continue in our show is to reinforce the need for human connection. And you're seeing that. We talked about solitary confinement for prisoners is not a reward, it's a punishment. And again, I want to just keep saying thank you for making sure these people don't feel like they're in solitary confinement. It just makes me so sad to know that these people in their time of need, right, they don't have access to the people in their life that love them and care for them. And
how many times a day typically would a patient have interaction with another human being, whether it's a healthcare worker or another person?
So on the COVID floors, I know we do like a great teamwork type approach to nursing on the direct positive COVID floors, where in the sense of like one nurse will do an assessment while the other nurse passes meds. Another nurse, just does vital signs and stuff like that. So they're constantly being greeted and seeing familiar faces. But and then like in ICUs and stuff where they're not necessarily there for COVID or they're just a patient, they'll see us every hour or so, but it gets lonely. Sometimes things get busy, you get sidetracked doing something else, you're not able to go in the room like as soon as you'd like to, and they could essentially they're alone for quite some time throughout the day. Sometimes we'll have TV on without music, so I try to always just throw a little music on in the background or something. Just give them something,
Yeah.
If they don't want to watch TV. Yeah, that's kind of what I've seen.
That's great. That's great. So what else do we have? We've got about 8 or 9 minutes left.
I'm curious about, so right now, we're in the thick of COVID-19, and personally, I'm curious to see what Chris has to say. How much longer do you think because I think there's multiple ways to ask this question, because there is the question of how much longer will life go back to normal, meaning, businesses come back, we can go to Wegmans without a mask on, things along those lines. Then there's a question of how much longer will the virus actually be present? Like, when's the last person going to talk about COVID-19? I mean, I'm curious about those timelines, because I hear, we talk about the mental McDonald's and making sure that what we take in is accurate, because it can sway our opinions so drastically. Mm-hmm. So we're constantly being bombarded by all these numbers, and I've heard so many various opinions. So now I have the opportunity to ask somebody who's actually, dealt with somebody who has COVID-19. So I'm curious what you think about it.
Well, fingers crossed soon, because I cannot keep wearing this mask to Wegmans every day now, getting these dirty looks when I take it off.
Yeah.
Unfortunately, there's not a real answer for that. I know, just speaking for my hospital, and I know, throughout the country, numbers are definitely on the decline, and that's something that, makes me feel really grateful for, and hopefully, it just keeps declining and we don't have another spike in positive cases. And I also have friends that live down in the South that, they're all of the restaurants and bars and everything's starting to open back up again, which is, a great sign. I know Florida, Nashville, Georgia, they're all opening up again. So, we are hopefully over the hump.
We're making progress.
We're making progress, yeah. It's all about the progress.
Yeah.
I even read something that in May, certain businesses are going to start opening up again, in phases type of thing. So hopefully, in my opinion, hopefully by the end of the summer, things should be hopefully eradicated. But
Yeah.
I'm not a professional. I don't study COVID. I don't have.
You just treat it.
Yeah, hopefully.
Yeah, hopefully.
Yeah, I mean, hopefully it's not too much longer. But you know, you gotta do what you gotta do. It sucks wearing a mask and having to be that cautious. But everybody has their opinions on if I should be wearing a mask, we shouldn't be wearing a mask, and all that. But at the end of the day, you just want everybody to be healthy. You don't want to spike this thing again, have to get set back in a way. But there's no real timeline, unfortunately. But things are looking up. Things are looking like they're getting better, moving in the right direction.
Yeah, I can vouch for that too. I feel like things have gotten better.
Yeah.
I know personally for my work, May 15th, so next Friday, we are completely starting full operational business.
Great.
So that means basically like COVID-19 has no effect on us at that point. So, and I know that this week most of the workers were starting to come back. We have a couple workers just getting everything from their remote offices ready and getting ready to migrate over. So it's a good feeling. It's we've talked about this before, the feeling of how much we loved our old lives. Like it's
right.
just
the gratitude,
the
the
gratitude.
new awareness we
Yeah,
had for some of the simple things, right?
like walking into Wegmans and not having a bandana over my face and looking like I'm going to rob the joint. I mean,
Right.
Getting dirty looks from old ladies. I mean, it's it's interesting now that is now the norm.
To be fair, everyone, of complete transparency, the reason DJ wants to be able to take his mask off in Wegmans because, like most Rochester people, DJ goes to Wegmans and treats it as a pickup joint.
Oh yeah.
So he gets his Sunday best outfits, right? He's going in there looking to impress and looking for the ladies. So now
You
He's
can't
a smart
tell if a
man.
girl's hot with the freaking
You can't.
mask.
You gotta hope.
Oh my God,
Gotta
you're taking a shot in the dark.
Can't flash him a smile. You got nothing.
They all dropped a lot of numbers in that.
So I'm really curious as to how the young men and women are going to respond when they're actually allowed to see other young men, other single young men and women at the end of this COVID thing.
At the same point,
I don't want to be too vulgar, but oh my goodness,
we don't probably. I mean, I'm speaking on behalf of females. We probably look like idiots too. I mean, like there's no attraction right now for human beings.
Yeah.
You gotta use your personality.
I
What?
gotta talk.
I gotta use my words
What do you
to
mean?
talk to you.
Yeah, like so maybe this is actually a good test.
yeah,
It is a good test.
yeah.
Hopefully we're all better at something by the end of this.
Exactly.
I hope so.
Yeah.
There's
a silver lining.
I'll tell you one thing that was brought to my attention the other day that I just think is completely amazing. This is the first time that we've actually quarantined healthy people.
Yeah.
Yeah.
Right? I mean, you think about that. The policy before was to quarantine the sick.
Yeah.
What happened? And I don't expect us to answer this question today, but I expect the audience to really take some time and reflect on this. What is it that was different about this virus that caused us as a country, as a world, to quarantine the healthy instead of quarantine the sick, right? So there's a lot of memes out there right now that says, look, it's not okay to go to church, but it's okay to go to Walmart, right? It's not okay to go to your gym, but it's okay to go buy liquor, right? It's not okay to do all these things. I mean, it's just weird.
Feels
So
like such a prevention.
yeah, there's something, we need to protect like you were saying. Actually, we didn't talk about it, but there's most of these patients, COVID patients that you see, have comorbidity type issues, right? It's not they're already immunocompromised in a lot of ways. Young healthy people or healthy people, I should say, deal better with it, right?
Oh yeah.
Yeah. So
That's kind of like the big thing with the masks is like you're doing it for those other patients, the people that have those comorbidities, they have heart problems, COPD, asthma, exacerbations, stuff like that. You're doing it for them. I mean, obviously, you could get sick as well, but your chances of getting seriously sick with COVID are a lot less than than these types of
You
people.
know, I keep, maybe I just have such a freaking selfish attitude. I keep forgetting that is really, you look at our society today, we're not a healthy society in general,
No,
right?
definitely not.
So in effect, wearing the mask.
Yeah, and we talked about this upstairs.
Yeah,
it's like I'm so sick of wearing this.
I'm
but
sick of wearing it, but if I'm going to be around people that are at risk, which is at this point a lot of us, because a lot of us aren't living the way we should live, right? We're not eating whole foods, we're not drinking a ton of water, we're not staying hydrated, we're not eating fruits, we're not eating vegetables, we're not exercising, we're not meditating, right?
Yeah.
So we are in a lot of ways not living the life that would make us strong against this virus or future viruses.
It's really like we're protecting the people we love.
Right. And the love of people, maybe.
And the love of people. I mean, like I would hate to say, I mean, granted, worst comes to worst, if I have it and then accidentally give it to some random person in Wegmans or go see my grandparents.
Right,
I mean, that's, and I've talked about this with a lot of my buddies. I'm like, that is seriously 100% the big conscious thing that I think about is basically other people.
Yeah.
Like having the ability to possibly hurt other people. That's the last thing that I think all of us want to be involved in.
You have that 2-week pre-symptomatic phase too, where it's like you don't even know, you could be passing around, you don't even know.
Yeah.
That's the scariest thing about it.
Yeah.
I mean, we may be wearing masks for a long, long time.
So we might have to get used to the girls at Wegmans.
Probably this kind of mask.
Yeah.
Not the other.
That's a fashionable one right there too.
This mask, not this.
You're just wearing both.
Yeah.
That would be
cover
cool.
everything.
Yeah.
Well, like you, I'm not coordinated enough to do something like that. I'm very clumsy. I probably break something.
Not allowed the double mask.
We're gonna have to watch out for the murder hornets now.
Yeah.
Apparently, it's
a
big up and coming thing.
So interesting, right? That now that's creating all this fear. So we were talking about it. My wife and I were talking about it, and I said, okay, stop reading me the article. Please stop reading me the article. I said, tell me how many people they've been in Asia, right? Yep.
Mm-hmm.
How many people died in Asia last year? 40 something.
Yeah.
I'm like, okay, it's zero, right? I mean, fundamentally, that's zero against that big a population. I said, how many times do you need to be stung by one of these to kill you? And she said, multiple. I said, okay. I said, how many times do you personally, because my wife's allergic to bees, regular bees.
Yeah.
I said, how many times personally do you need to be stung to die? She said, multiple. I said, exactly. So this murder hornet, right, again, is not a murder hornet unlike a regular bee to people that are allergic to bees.
It's all
right?
Just a
my wife,
it's all the same. They're just a little bigger.
They're just bigger, right?
Yeah.
But yet we have a media that wants to create fear, uncertainty, and doubt in a public. Because they're fighting for eyeballs, people. They're trying to get your attention so they could get advertising money from you.
Yeah.
So
right now.
So go into every communication from our media understanding that there's a reason they're communicating to you the way they are. They want your eyeballs. They're fighting with this YouTube person that has 12 million subscribers that's getting $1 million a year from Adidas or whatever, right? Because they're a $12 million YouTube person or 12 million member YouTube person.
Yeah.
This is why the media tells you they're murder hornets.
Well, they're just hornets.
They're hornets. They're big. They're 2-inch hornets. They're big hornets.
Big bee.
That's right.
Yeah.
The real danger is to the bees.
Yeah.
Apparently.
Doesn't a bee die when it stings you?
Yeah.
All right. So they should be. So we're murder humans then to them.
Murder humans.
Yeah. That's the way we should switch it.
Little off topic,
Yeah.
but yeah.
That's all right.
So Chris, any closing thoughts, or DJ, any closing thoughts?
You can go first, Chris.
I don't really got any. It's just. Just be safe, wash your hands. You've been through, I'm sure, through the ringer with that. I know I have, but just think about other people. When you're going through your everyday life. I know nobody wants to wear a mask every day. Nobody wants to take these precautions, but just think about it. You're doing it for other people. It's not just for yourself, and just pretty much that's all I got.
Yeah, I want to take this time to personally thank all. Frontline essential workers. I remember a couple days ago, I was talking to somebody and I told them how I was still working, and they were like, "Oh, you're essential." I said, "I'm essential, but I'm not essential." like I'm not a guy in there or somebody in there actually saving people's lives, making their lives better. So I want to personally say thank you to those people who are actually, you know, going into the belly of the dragon.
And yeah,
every day,
putting themselves in harm's way.
putting themselves in harm's way to make sure that our society, our world, our future necessarily is safer, and we can progress and we can start, you know, getting business back up. You know, people like Chris who essentially right now, when we talk about these solitary confined patients, Chris is their family. Chris is walking in there going, hey, you know, I'm here with a smile. I'm going to help you out. I'm going to give you a good nature, a good vibe right now. And then, you know, Melissa's going to come in and you got a FaceTime call with your mom, with your whatever. So I think, you know, everything that these workers are doing is 100% what we need to do right now, and they're doing a hell of a job doing it. So I want to say thank you to everybody.
I want to add to that too. You got to also do a big shout out thanks to like Wegmans workers, you know, DoorDash. I wouldn't be living right now if I didn't have DoorDash, Uber Eats, you know, UPS, Amazon, all of those workers too, you know, they're not necessarily in the front lines, but they're helping everybody out, you know, delivering, providing us, you know, a somewhat normal life from before coronavirus to now. They're still, you know, seeing all of us, helping all of us in everyday lives, and you just gotta also say shout out to those guys too.
That's a very good point, because we wouldn't, I mean, you know, if Wegmans or Walmart or these places went down, then it'd be anarchy. I mean, think about that.
It'd be anarchy.
It'd be anarchy. So yes, very good point. Thank you to those Wegmans workers. Shout out Dante Giordano, new Wegmans employee. He's stocking the shelves late night, the graveyard shift. So thank you to that. You know, we actually need that, 100%.
Awesome, gentlemen. Well, thank you very much, Chris, for taking time. DJ, always a pleasure.
Thank you.
Looking forward to our post podcast commentary.
Oh yeah.
So thanks everybody from the Acres of Diamonds community. Have a great week. We're out.
Thank you guys.